We've been witnessing high temperatures over the last few weeks, and intense heat can cause a heat stroke, a serious condition which is caused by prolonged exposure to high temperatures. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospitals, the Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about heat stroke in our today's episode. Joining us today is Dr. K. Somnath Gupta, consultant physician and diabetologist from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor.
Hi.
So the Indian Meteorological Department has issued a heat wave warning for several parts of the country. So what exactly is heat stroke and how does it impact the health doctor?
So definitely it is one of the apt question this season. As we know, the summers are peaking and it's mid-April and now it's like huge temperatures are more than 40 and we could see there's a lot of heat waves coming and a lot of people have been suffering with these heat waves. So we need to crucially discuss right now about this topic. When we talk about heat, its first thing is what actually is this heat exhaustion and heat stroke we need to know. So when the temperatures are peaking more than 40, a lot of people been experiencing as well as exposing to this high degree temperatures on a prolonged period, and because of high physical activity, they may drench and they may sweat a lot and can lose their fluids and electrolytes and can cause some symptoms like weakness, tiredness, fatigue, headaches, nausea, vomitings, high fevers, as well as they can cause a kind of weakness and that can lead to fainting spells. Even some may lose their consciousness and can come to casualty and admit there.
So heat stroke is one of the commonest conditions in our country affecting millions of people. So how emergency or critical do you think this condition is, doctor?
Mainly this hypothermia, like high temperatures. When we expose these high temperatures, patient initially present with few symptoms which are warning signs, like they present with headache, weakness, tiredness, fatigue. Few may oversweat, few may be having high temperatures. But if we neglect this, he may lead into a heat stroke, which is a complicated condition where the patient have low blood pressures and the patient may faint and even have loss of consciousness. Similarly, may attack seizures. So whenever we have a heat exhaustion, before going into heat stroke, it is always better to approach doctor or to a casualty and treat ourselves as soon as possible.
So are there any risk factors or any particular age group which are affected more?
Definitely children are more vulnerable for heat strokes and elderly people who are more than 65 years. Similarly, people who have comorbidities like diabetes, heart-related diseases, kidney-related issues, it's better to avoid exposing to this hot sunlight mainly during this April and May season.
So what are some common warning signs or symptoms that people could be experiencing, and when do you think they should seek medical help for this?
When they expose this to high temperatures, they first present with high-grade fatigues, high temperatures, and they have a moist skin, and they have this high heart rate. I mean to say there's a rapid heart rate but weak pulse. And they have this low blood pressures leading to fainting spells. Few present with headaches. Few may have abdominal pain, nausea, vomitings. And finally, they have a weakness throughout their limbs as well as they feel tired, fatigue.
So once a person is diagnosed with heat stroke, doctor, what is the treatment protocol that you follow?
First, we need to remove his tight clothes, make him wear light wear, and then use some cold packs or cold blankets. If the patient may land into heat stroke, hydrate him, make him to hydrate well, either by oral fluids or if he is not conscious enough, we can give IV fluids. IV fluids can be given in terms of cold salines also, which can help in decreasing the temperatures. Using cold blankets or ice packs will also help in lowering the temperatures. Finally, the target is to lower the temperature and making him hydrate well. This will help in first aiding him as well as relieving the complications or preventing the complications.
So I'm sure that most of us can't avoid stepping out. So what are some preventive measures that we all could follow to prevent heat stroke?
First thing, in the summers, hydration is most important thing. Taking good amount of fluids, at least 3 to 4 liters a day. Fluids, mainly water, a lot of liquids in terms of juices, ORS, tender coconut, buttermilk. Avoiding tea, coffees, similarly hot drinks, whiskey, these kind of things can dehydrate more. It's better to avoid. Hydrating at least 3 to 4 liters a day. In terms of clothing, it is always better to wear light clothes as well as light colored, as well as it is easy, comfortable to wear, and as well as mainly in terms of remaining in the timings between 10 to 4, it is better to avoid these timings. It is always to be doing your works before 10 a.m. and after 4 p.m. And always be in shady areas, as well as exposing to AC environments, as well as when there is no ACs, at least wear light clothes and make you comfortable remaining in a sunshade areas.
So discussing about preventive measures, what are some lifestyle modifications that we all could follow, especially during this season, doctor?
Eat lighter, take foods which are having less fat contents, avoid masala, biryani, spicy items, and the foods which are difficult to digest, and the foods which need a lot of energy to break. Similarly, taking a lot of fluids, hydration, and avoid exposure to hot sunlights, and wearing a light clothes, and better to do your works before 10 a.m. and after 4 p.m. These are the best things to do, at least to prevent these kind of sunstroke related complications.
So before we wrap this episode, doctor, what message you would like to share with our audience out there as far as heat stroke is concerned?
First, regarding heat stroke, during this April and May in India, better to avoid hot sunlight exposures, hydrate well, wear light clothes, and be in the sunshady areas. Whenever you have some of complications of this heat stroke or heat exhaustion, like headaches, vomitings, as well as dehydration symptoms, high temperatures, it is always approach doctor as soon as possible before complicating ourselves.
So thank you, Dr. Somnath, for being here.
Thank you.
So this brings us to the end of this episode. Remember, heat stroke becomes more manageable with the right knowledge and right support. Stay informed and stay proactive, and don't forget to tune in for next week as well. Until then, take care and stay healthy. Thank you.